as we're going through care with a patient and they're starting to feel better, function better, and they may be getting to this point in the care where symptoms are relieving, relief is happening, and ultimately are feeling better. The question I always ask a person is, what are your goals? Again, coming back to that, what are your goals? I would love to see everybody move towards wellness care, but that's not everybody's goal. So some people's goal may be, hey, I just want to feel better. And ultimately, if that's your goal is, hey, I just want to feel better, great. You might decide at this point, hey, I'm good. I'll see you when I need you again. But you might not be deciding that. You might be like, hey, what I just went through, I don't want to go back through again. Or, hey, I want to actually continue to benefit from these things that I've already been doing and actually continue to benefit more and more and more. So for those people that are at that point where like, hey, I want to continue, I'd be like, great, this is what it's going to look like. And then the thought would be able to take that person into corrective care, into maintenance care, or even into wellness care, down this spectrum into what else more could potentially be. And honestly, I love this part, for one, helping patients get better, feel better, the pain's going away, function's improving, but I even love the corrective care and the wellness care even more, because we get to see even more what the body is capable of. And so when we come into corrective care, we look at what the goal of that person is. If they were already doing chiropractic, then the one thing is we'd want to continue to do chiropractic and continue this way. If they were already doing physical therapy, maybe we could switch that person over to massage therapy. If they were taking supplements already at the beginning, well, we probably want to continue taking those supplements as well. If you were doing exercise and stretches, well, we want you to continue to do those as well. But ultimately, it's about keeping that puzzle together so that ultimately you can continue forward. You've got to continue to do the daily work as we're moving forward, committing to yourself, working out, exercising, stretching, trigger point work, whatever it is, drinking your water, eating well. And so as a person's coming into corrective care, I really, truly, honestly get excited about this. Because back at the beginning, when a patient begins care, we do not only the evaluation, but we always take x-rays. We see somebody from the initial x-rays where maybe their spine was curved, or maybe from the side they had the head was carried forward, whatever it be structurally. When we can look at x-rays on a 1-year x-ray and see that x-ray actually positive change towards what is more normal, and truly, honestly, in a better structure, better function, that gets really exciting. And not only does the patient start to get celebrate, I get excited because I'm like, yes, the body can change, the body can heal. And ultimately then it ultimately just commits, hey, what would happen if I commit to another year? Or what happens if I commit to a second year or third year? And when we sit down and we do those yearly reviews in this corrective care and into the wellness care and maintenance care, when that continues to improve every single time, that is really what gets exciting. Ultimately, we can make a change for our body. Our bodies can heal, our bodies can improve, but ultimately it depends on what we're going to choose to do day in and day out. Now at Total Health Systems, we have a wonderful pamphlet, and I love it. It's everybody has a puzzle. So what your puzzle might be different than my puzzle, but it's a matter of finding that pieces of the puzzle so that ultimately you can continue to feel better, and ultimately symptoms are gone, feeling great, ultimately going into optimal health. This is for somebody that's looking for more, looking for better quality of life, being able to continue to have that on every single day of their life. This would be an option for you. And I definitely am excited here at Total Health Systems to possibly be a part of that team, or any one of us here at Total Health Systems, any one of our providers. We certainly have an amazing team, and as we work together and realize what we do best, I'm a chiropractor, I'm not something else, but I can definitely help you on that end of it if it happens to be a part of your puzzle. So I look forward to meeting you one day, or having one of our team meet you, and so thank you so much.